My name is Dr. Matthew Bernard. I'm one of the emergency doctors and also the medical director of Touro Emergency Department. Thank you for having me. And today we're going to talk about stroke a little bit. Simply put, a stroke is when a piece of the brain begins to die from not getting enough oxygen. The main two types of stroke that we see are a bleeding stroke or a stroke because of a blood clot. And so a blood vessel can burst open through a weak spot like an aneurysm, sometimes due to elevated blood pressure. And also you can have a blockage in our blood vessels, and that can cause a stroke as well. That's a much more common type of stroke. About 75% of strokes are the blockage type. A stroke is when a piece of the brain is dying, so it depends on how much of the brain is dying or what piece of the brain is dying. And so if you have a small piece of the brain dying, you might see small symptoms. If you see a larger piece of the brain, you might see greater symptoms. But it really can come out in a variety of symptoms. So it could be a facial droop. It could be somebody not speaking appropriately or not able to find their words. It could be a weakness, so they might not be moving their arm. They might not be moving their leg. They could be dizzy. They could be off balance. And also it could be just a severe headache. That's a common presentation of the bleeding type stroke. F.A.S.T is a great way for family members and people to look for and identify strokes. And so F stands for face. And so you might see somebody's face droop and you can ask them to smile really big, and that's a great way to see if each side of the face looks the same. A for F.A.S.T stands for arm, and you can ask somebody to raise their arms and see if one arm begins to droop. You can also have somebody squeeze your fingers on both sides and see if they feel equal and the same. S is for speech, and so someone might have slurred speech or they might have altered speech. They might not be speaking normally. And then T is for time. We really need to know when a stroke starts because we have a limited amount of time to really fix people. Our best options are within about 3 hours of having a stroke. So it's not something we want you to wait until the morning and see if it wears off. Fast, and the major point of this is we need to be really fast. You need to come to an emergency department and let us evaluate you as quickly as possible. If you see any symptoms and you're concerned about stroke, please come to the emergency department. Call 911. There are a lot of things that could be strokes that people may not recognize at home. Also, a lot of strokes don't come with a lot of pain, and so patients may not recognize the urgency to be evaluated really soon. We move really fast at Touro Emergency Department, so the worst that can happen if you come and it's not a stroke is that we'll see you, we'll evaluate you quickly, and then we'll get you home safely. But if you wait, we may not be able to fix the stroke, and so that's the worst thing that can happen. So we always want you to come to the ER immediately if you're ever concerned about having a stroke. There's plenty of known risk factors for having a stroke. Some of these are high blood pressure, and this is typically related to how much sodium somebody takes in. And that high blood pressure can cause the blood vessel to burst open, and that's that bleeding type of stroke we talked about. Other risk factors are things that might clog our plumbing. Our blood vessels are our plumbing, just like a kitchen sink might have. And so things that might clog the pipes are things like diabetes, where you have too much sugar and too much fat in our plumbing. Also high cholesterol, especially the bad cholesterol, or the LDL. The people that may have a stroke are typically going to be male. The African American population is more at risk, possibly because of the increased incidence of hypertension. And of course, things like illicit drugs like amphetamines or speedy substances put you at great risk for having a stroke. When you have a stroke at Touro, we're going to look and see if we can give you a clot buster. This is one of the medicines that we can use to try to help reverse a stroke. And it's important we do this in just within a few hours from the start of the stroke. And so that's why we need people to come to us very quickly. And so we can use TPA, that clot buster. We can also use medicines like aspirin or other antiplatelet agents. If you've had a bleeding type of stroke, though, what we'll try to do is reduce the pressure in the brain. We'll try to control the vital signs, especially like the high blood pressure. Recently, last year, we had a rigorous site review of our stroke program, and we were fortunate enough to receive the Joint Commission Golden Seal of Approval, as well as American Heart Association and American Stroke Association Heart Checkmark. Both of these are incredible symbols of excellence for advanced centers for primary stroke care like we have. And so we're very proud of the care that we give, and we're proud of being recognized for our excellence. Touro's rehab program is known all over the state, and I think it's bar none the best. And ideally we want you to not have a stroke, but once you've had that stroke, if you have been in that position, rehab is the most important thing. It should start immediately after having the stroke, and it's going to be aligned with the patient's goals to get them back into the community, to get them back in their life.